Acitys uses, dosage, side effects interactions. Acitys is the brand name for a medication containing the active ingredient acetylcysteine. Acetylcysteine is a medication used to treat paracetamol acetaminophen overdose and to thin respiratory mucus. Acetylcysteine works by 1. General introduction to Acitys. Acitys is the brand name for a medication containing the active ingredient acetylcysteine. Acetylcysteine is a medication used to treat paracetamol acetaminophen overdose and to thin respiratory mucus. Acetylcysteine works by 1. General introduction to Acitys. Preventing and treating paracetamol overdose. Acetylcysteine is the specific antidote for paracetamol overdose. It works by replenishing glutathione, a naturally occurring antioxidant in the body, which helps the liver effectively eliminate paracetamol from the body. 1. General introduction to Acitys. Thinning respiratory mucus. Acetylcysteine helps reduce the viscosity of mucus, making it easier to clear the airways and improving breathing, especially effective in treating respiratory conditions such as bronchitis and pneumonia. Dosage. Paracetamol overdose. The dosage and method of administration are prescribed by a specialist doctor based on the severity of overdose, the patient's health status, and weight. Dosage. Treatment of respiratory conditions. The dosage is prescribed by a doctor based on the patient's medical condition and health status. Method of administration. Paracetamol overdose. The medication is administered orally, intravenously, or by intravenous infusion. Treatment of respiratory conditions. The medication is usually administered orally or by inhalation. Note: take the medication as directed by your doctor. Method of administration. Do not change the dosage or stop taking the medication without consulting your doctor. The medication can be taken with water or juice. Do not use expired medication. 3. Side effects of Acitys. Acetylcysteine has a relatively wide safety margin. However, using the medication can cause some side effects, including common nausea, vomiting, less common drowsiness, headache, tinnitus, mouth sores, increased nasal discharge, rash, hives. 3. Side effects of Acitys. Rare bronchospasm accompanied by a systemic anaphylactic reaction, fever with chills. Note: immediately inform your doctor or pharmacist if you experience any side effects while using the medication. 3. Side effects of Acitys. If you have any signs of an allergic reaction, such as difficulty breathing, facial or lip swelling, stop taking the medication immediately and seek medical attention. 4. Interactions of Acitys. Combining Acitys with certain other medications can cause interactions, leading to reduced efficacy or increased side effects. Some notable interactions. Antibiotics. Acetylcysteine can reduce the effectiveness of some antibiotics such as amoxicillin. 4. Interactions of Acitys. Anticoagulants. Acetylcysteine can increase the risk of bleeding when combined with anticoagulants such as warfarin. Diuretics. Acetylcysteine can enhance the diuretic effects of some diuretics. Note: 4. Interactions of Acitys. Inform your doctor or pharmacist about all medications you are taking, including prescription drugs, over-the-counter medications, herbs, and vitamins, to avoid unwanted drug interactions. 5. Precautions when using Acitys. Do not use acetylcysteine if you are hypersensitive to the active ingredient or any component of the medication. Pregnant and breastfeeding women should consult their doctor before using the medication. Patients with asthma or a history of allergies should exercise caution when using the medication. 5. Precautions when using Acitys. Do not self-medicate with Acitys for paracetamol overdose without a doctor's prescription. Store Acitys in a dry, cool place, away from direct sunlight. Keep Acitys out of reach of children. Note: 5 precautions when using Acitys. The information provided here is for informational purposes only and cannot replace the advice of a healthcare professional. Consult your doctor or pharmacist for advice on using Acitys safely and effectively.